Hello, welcome to this module. We're talking about peripheral spondyloarthritis in this module, and we have already done an axial spondyloarthritis module. So there is some crossover in there as well with regards to things like inflammatory back pain, some of the comorbidities, and you may find as we go through this, we skip over a few things, especially as I mentioned, like inflammatory back pain, because there's a lot more detail about that in the axial spondyloarthritis module. So if you haven't watched that one yet, these two do couple nicely together. Also, as we will discover as we go through, there is a component of patients who will have axial combination symptoms along with their peripheral ones. So some of the information in there specifically regarding that will obviously be very helpful. But in this particular part of the module, we're going to talk about pathophysiology of peripheral spondyloarthritis. These are essentially enthesitic diseases, but there are some differences with regards to how they present and the kind of presentation of a patient comparative to axial disease and certainly compared to the synovitic diseases. So we're going to talk about the phenotypes of peripheral spondyloarthritis, enthesitis, the presentation, and also the demographics that tend to be affected. So the phenotypes that we're going to get in the peripheral disease, you can see the axial ones there, and of course we talked about that specifically in the axial spondyloarthritis module. These are mostly going to be psoriatic related, so related to psoriasis or psoriatic arthritis would be their term. Probably around 75% of the peripherally dominant spondyloarthritis patients are going to be related to psoriatic arthritis. So just remember these heading terms, axial and peripheral, these are the predominance of the symptoms. So we're talking about predominantly peripheral symptoms, and of course they may well have some axial symptoms as well. Most of the rest of these patients are going to be made up by enteropathic related spondyloarthritis. So these are going to be related to inflammatory bowel disease, things like Crohn's disease and ulcerative colitis. You do occasionally get a patient who is just a pure peripheral enthesiopathy, so an inflammatory enthesitis, multiple sites, and it's not related to psoriasis or inflammatory bowel disease. They do occur, but they are fairly rare, and actually their presentation from our musculoskeletal point of view will look exactly like either a psoriatic or enteropathic patient. They just don't have that comorbidity to help you out.